What is halitosis? Halitosis, otherwise known as bad breath, is described as a bad smell that comes from the mouth when one exhales. Bad breath may come from the mouth or from an underlying medical condition, such as respiratory infections, gastrointestinal infections, and sinuses, among others. Most causes of bad breath can be controlled or managed. Bad breath has been classified into two categories. The first is transient, where it disappears after flossing, eating, or brushing the teeth. The other type is transient, which may require a person to seek medical help. So, now that you know a little bit about halitosis, here are some of the causes of halitosis. Aromatic foods such as garlic and onions are a common cause of bad breath amongst most people. The chemicals that are contained in these foods are absorbed by the intestines and go into the bloodstream. The blood then reaches the lungs where the chemicals are released into the breath. When we eat, small particles of food are usually trapped in between the teeth. The usual bacteria inside our mouths start to feed on these particles of food. When the bacteria start to break down the food, it results in foul smell emanating from the mouth unless we brush our teeth to get rid of the bacteria and food particles. Gingivitis, or an infection of the gums, can cause bad breath. Poor oral hygiene leads to buildup of plaque, which causes bad breath. Tooth abscess and cavities are the root causes of bad breath. The bacteria from the tooth abscess and cavity can cause bad breath. Smoking causes bad breath in three ways. First of all, the smoke remains on your breath and results in bad breath. The second way is that smoking contributes to gingivitis, which contributes to halitosis. The third way is that smoking significantly dries up the mouth, which results in bad breath. Alcohol is a volatile meaning that is easily evaporates into the air. When you consume alcohol, it is absorbed into the bloodstream, and as the blood passes through the lungs, alcohol can be released into our breaths, causing bad breath. Underlying medical conditions such as sinuses, respiratory infections, gastrointestinal infections, and kidney and liver disease can be causes of bad breath. Medications that cause a dry mouth have been known to contribute to bad breath. Saliva usually acts as a cleanser for the tongue and the mouth, but when the mouth becomes dry, it creates a ground where bacteria can build up and cause the breath to sink. Here are some of the symptoms of halitosis. A self-prognosis can tell you whether you have bad breath. The first test is to lick the back of your hand and let the saliva dry. Once it dries, you can smell it. You can also try to scrape the back of your tongue and smell the residue once it dries. Another way of telling whether you have bad breath is to use a halometer, which can be found in most hospitals. They work by measuring the level of sulfur emissions in your breath. The device requires one to avoid alcohol, garlic, and onions for a period of 24 hours before being tested. Well, that's a quick overview of halitosis, and I hope you enjoyed this video. Go to our website, home-remedies.com. You'll be able to find lots of information on bad breath, halitosis, hemorrhoids, and other things. So go over there, take a look at it. I hope you enjoyed this video. My name's Jeff. Thanks for watching.